Quick disclaimer. Information in this podcast is for general informational purposes only and is not intended to be treated as medical advice. Always consult with your healthcare team before making changes to your diet, lifestyle, supplementation, or medication.
Are you tired of relying on medication to manage your type 2 diabetes? Or perhaps you were never given any other option, but you're curious to find a better way to manage your health long term. Well, keep listening to learn how you can reduce or even stop your diabetes medication naturally.
Welcome to Type 2 Diabetes Talk, the place where we chat about what really works to treat type 2 diabetes and prediabetes naturally with nutrition and lifestyle. If you're looking to optimize blood sugar and A1C, lose weight, reduce medications, and improve your overall health, this is the place to be. Now, here's your host, type 2 diabetes nutrition specialist, Dr. Jetta.
Hello and welcome back to Type 2 Diabetes Talk. Dr. Jetta here, and today we're going to tackle a question we often get asked. How do I get off my diabetes medication? Such a fantastic question, really. If this is something you've been wondering about, you're in the right place. Whether you've been newly diagnosed or have been managing type 2 diabetes for a while, there are proven ways to reduce or even eliminate your reliance on medications, and we'll cover all of that in today's episode. Just to clarify, this episode is specifically focused on type 2 diabetes, and in a future episode, we'll discuss medications for pre-diabetes. If you do have further questions after the podcast, I invite you to head over to our website and submit an email or voice message, and we'll cover it in a future episode. Getting off medication. In reality, many people never even consider that getting off medication could be an option because, let's face it, the usual thing that happens is you go to your doctor, get a diagnosis, and the next thing you're being prescribed medications. From there, it's often more and more meds. The opposite conversation of deprescribing medications is one that rarely gets discussed, and perhaps if you're new to the podcast, you haven't considered it for yourself. It is an unfortunate truth that there is an over-reliance on medication within our medical model and the treatment system for diabetes. Although nutrition, diet and lifestyle are listed as foundational for diabetes treatment in all the medical care guidelines, the reality is many people never receive any other option because the standard medical approach is to prescribe medication. While medication can be helpful and sometimes necessary, if you need to take more and more medication, it indicates your diabetes may be getting worse, not better. Ideally, we don't really want to see you solely relying on medications. We want you to experience the opposite, to have your diabetes health improving with your blood sugar and A1C normalizing through natural and sustainable means. It's also important to understand that the effectiveness of diabetes medications can be limited, meaning they can only influence A1C by a certain amount. For those newly diagnosed who may be listening, A1C is a blood test done by your doctor that measures the average glucose or sugar on your blood over a 3-month period. It's used to diagnose diabetes and to assess your diabetes control. So diabetes medications can only exert a certain lowering effect on A1C. For instance, metformin can reduce A1C by up to 1.5% at the maximum dosage, while SGLT2 inhibitors might only lower it by 0.7% at the maximum dosage. This often leads to the use of multiple medications simultaneously, a practice known as polypharmacy, which can result in a host of side effects and complications, especially over time. So again, ideally, we don't really want to see you solely relying on medications. First, let's be clear about one thing. Medications can be an important part of managing diabetes, especially when blood sugar levels are dangerously high. Medications like metformin, sulfonylureas, DPP-4 inhibitors and SGLT2 inhibitors, insulin and others, they help lower your blood sugar levels, and they can be life-saving when your body needs that support. However, medications are often seen as a long-term solution, which isn't always the case. What many people don't know is that nutrition, diet, and lifestyle changes can have such a profound impact on your health that they can reduce and even eliminate the need for medications altogether. Yes, deprescribing medications, or the process of reducing or stopping medications, is possible, and it is a topic that deserves a lot more attention and education to inform people of the possibility, as we know many people do hate taking medications. So can you get off medication? For many people, most people in fact, you will be able to reduce medication, and many will be able to stop medications too. On the opposite side of the equation, we've got those of you who may not be on medication yet and want to avoid it. Well, the information in this podcast is equally as important to you too. What the evidence actually shows us is that deprescribing medications, getting people off medications, or at the very least reducing the number of medications or the dosages is not only possible but beneficial. Why would that be? One of the primary reasons is side effects. Long-term use of medications, even ones like metformin, can lead to vitamin B12 deficiency, while others like insulin and sulfonylureas, they increase the risk of hypoglycemia, which can be a major issue the older you get. Studies also show a whole range of minor side effects related to diabetes medications that, well, they aren't so minor if you're experiencing them. For instance, blurred vision, lightheadedness and weakness are very common side effects of diabetes meds that could be overlooked but could seriously affect your life if they lead to falls and hospitalizations. And these things do happen. These are all documented in research findings. Polypharmacy is another reason. Polypharmacy is a fancy word for taking multiple medications, which is common in people 60 and over. But it's really not good for anyone due to the potential side effects and drug-to-drug interactions. Reducing medication can decrease the burden of managing multiple drugs and their associated side effects, which leads to an improved quality of life. The evidence suggests there is an overwhelming benefit of reducing medications in diabetes, and we know this is highly possible, so it's something we should all be encouraging and supporting. Importantly though, you do need to work with your doctor to reduce and stop medications, and we'll be covering more about this as we move through the episode. So you might be thinking, when is it a good time to consider getting off medications? Studies have shown that for those with stable and low A1C levels, 7% or below, deprescribing medication doesn't significantly affect blood glucose control in most cases. In other words, if your A1C levels are stable at 7% or below, it's time to consider talking to your doctor about reducing the medications, as the research shows that in many cases it makes no difference to A1C levels to deprescribe. No difference. A1C levels stay stable. Of course, it's going to be even better if you can achieve levels below 6.5%, or better yet, A1C levels below 6%, because once your levels are in that normal range or close to, doctors are usually happy to support reduced medication. So you may be thinking, well, what's the secret then to getting off diabetes medication? Well, the key lies in addressing the root cause of the problem, which is high blood sugar levels and high circulating insulin levels that both promote insulin resistance. And how do we do that? It largely comes down to nutrition and diet. These are your most powerful allies, and your overall lifestyle can be an influence too.
Are you ready to take charge of your diabetes health? Dr. Jetta's T2 diet program has been clinically proven in a randomized controlled trial to dramatically reduce A1C, weight, and medications in just 16 weeks. The T2 diet program will guide you step by step to discover an eating plan that feels natural and sustainable for you, and most importantly, works to get results. Learn more and join the program today at type2diabetestalk.com/programs.
So let's get down to the how. What steps do you need to take if you want to reduce or stop your diabetes medication? Well, it's crucial to do so under medical supervision. So the first step to take is to never attempt to do it alone without advising your doctor. It's always important to discuss your desire to reduce or stop medications with your medical doctor, GP, physician. Now, that conversation might not happen right away, as you might first want to work toward achieving a stable A1C level first, as your doctor is going to take you more seriously if your levels are stable below 7% or below 6% is even better, as we emphasised before. That said, certainly, if your doctor is suggesting you should go on medication or take more medication and you'd prefer not to, you should be assertive and discuss your goals and desires with your doctor. If they try to object, you can kindly suggest that they please give you 3 to 4 months to turn things around on your own before having the medication discussion again, which will give you time to focus on getting proactive so you can get your A1C down naturally. And once you return to your next appointment, your conversation with the doctor is going to look a whole lot different. And that's the key. In order to reduce or get off diabetes medications, you need to get your A1C levels down into that healthy range, below 7% and ideally below 6%. How do you do that? Diet and nutrition is your primary treatment strategy. Focus on eating to treat your diabetes, the details of which we covered extensively in episode 6. What you eat has the most powerful impact on your blood sugar levels and your overall metabolism and health. Food is the fuel that feeds all our cells, so quality nutrition is key to treating your diabetes naturally. If you get proactive with your nutrition plan, you can bring your A1C down by as much as 3 or 4% in 3 to 4 months. We've seen this happen a lot when people take my clinically proven T2 diet program. Having an A1C reduction from 10% down to 6 or 7% is possible in the 16-week program. If your levels aren't as high as 10 when starting, then achieving 6 or 7% in around 4 months is possible. So here's the thing. The overall quality of your nutrition plan is important, but of course, the key macronutrient that influences blood sugar is carbohydrates. By reducing the amount of sugar and carbohydrates you eat, you help reduce blood sugar spikes and lower the amount of insulin your body needs to produce. This can lead to more stable blood sugar and A1C levels and over time reduce your need for medications. In episode 22, we covered 3 simple steps to lower carbs and focus on the right types to lower A1C. So go and listen to that episode for key steps to take first. Essentially, you just need to get proactive and put the right nutrition strategies in place, and you will see your A1C levels come down and stabilise. So you can then have that discussion with your doctor to reduce or stop medications. Of course, that sounds simple enough, I know, but it isn't always easy to do, especially without support, which is where our programs and memberships can really help. So again, please head down to the website and take one of our programs or join us as a member. It will honestly be the best thing you ever do. Okay, yes, I may be a bit biased, but honestly, I'm hearing about our members' success all the time, and I genuinely know our programs work. They've even been clinically proven by the highest standard of evidence, a randomised control trial, which is why I want you to know about them and that we're here to support you if you need it. The other thing I want to mention is if you're using a blood glucose monitor, focus on your postprandial levels, your after-meal blood sugar levels. You need to be keeping these levels under 140 milligrams per decilitre or 7.8 millimoles per litre 2 hours after meals, as this will help you lower your A1C levels into the healthy range. You can listen to more on healthy blood sugar ranges and why your postprandial, your after-meal levels are so important back in episode 11. Regular physical activity is another major component to this puzzle of getting off meds. Exercise improves your body's sensitivity to insulin, meaning your cells are better able to use the glucose in your blood, which helps lower your blood sugar naturally. So add a little more activity to your daily routine, whatever it is, walking, swimming, gardening, resistance training, yoga. It's all going to help improve insulin sensitivity, which is very important to overall blood sugar control. Incorporating mindfulness practices, managing stress, and improving sleep quality can complement nutrition changes and physical activity for a more holistic approach to stabilising blood sugar and A1C levels as well. Before we go on to discuss this further, let's hear a testimonial from one of our members.
Joanne said, "You have been so much help to me this past year. My A1C started out around 9.5. It has been at 5.4 for the past 6 months. I have lost close to 50 pounds. Thanks for all your help."
When it comes to getting off the diabetes medications, there are different methods, including complete withdrawal and discontinuation of all medication. That doesn't tend to happen as much in general practice. It does in some clinical trials, but not as much in general practice due to the conservativeness of doctors, which is understandable. So reducing dosage over time is more common, and if you're on multiple medications, stopping one medication and then another is usually what happens. As you and your body demonstrate that you can maintain stable A1C levels with each medication reduction, your doctor will eventually stop all medications. So the most common track is reduction of dosages, then stopping one medication at a time, or if you're only taking one medication, it will be a reduction of dosage until cessation of that medication. If all you're taking is metformin, you may be able to come off it sooner by replacing it with a natural therapeutic like berberine, which we discussed in episode 21. One of the most important factors in all of this is your mindset and commitment to you. The journey to reduce or eliminate medications is possible, but it requires proactive management and a shift in mindset. You need to be consistent in making healthier choices, not perfect, as consistency is more important than perfection. And you need to understand and accept that progress takes time. There's no quick fix 3-day pill to achieve the goal of getting off medications. Yes, it can happen. Knowing that it can happen and holding that hope are certainly powerful motivators in committing to you. But getting off medication usually doesn't happen overnight, so it's important to have patience as well. Take small, proactive steps with your nutrition and lifestyle and keep taking them. There's a saying I really enjoy, and that's, healthy isn't a goal, it's a way of life. Focus on the right things until you get there. Keep being proactive with your nutrition and lifestyle, as small steps really do add up to big changes over time. If your goal is to get off medications, you can do it. And we've covered the key things that will help you achieve that goal right here in this episode. Namely, the first primary treatment strategy is your nutrition and diet. You can head back to listen to other key episodes mentioned throughout this podcast. Episode 6 on how to eat to treat diabetes. Episode 11 on healthy blood sugar levels and why your after-meal levels are important to lowering A1C. Episode 21 about berberine a natural therapeutic that's been shown to be as effective as metformin. Episode 22 on the 3 simple steps to take to lower carbohydrates in order to lower A1C levels. We also did a fantastic medication series in episodes 15, 16, 17 and 18, and I'd highly recommend you go back and listen to those episodes for lots of valuable insights and information. And please do consider joining one of our nutrition programs or joining us as a member, as our programs and services really help remove any confusions about what to do and provide all the tools, resources and support to help you achieve lower blood sugar and A1C so you can reach your goal to reduce and stop the meds. Of course, if you're already one of our members, and I know lots of our members listen to this podcast, head to the Members Library for a more detailed roadmap on reducing your medications, along with a letter you can provide to your doctor. And be sure to use the monthly member check-ins to share any challenges you're facing so we can help you with those. And share your progress as well, of course, as we love hearing about that too. Thanks for tuning in, and if you feel this information would help others, please share. I'm sure that they will thank you for offering them hope of another pathway that doesn't solely rely on medications to manage their diabetes as well. That's all for today. Dr. Jeddah, over and out.
Thanks for tuning in to Type 2 Diabetes Talk. Please subscribe to the show on your favorite podcast platform. And for episode replays, episode notes, and more, visit type2diabetestalk.com. New episodes are available Tuesdays, 10 a.m. US Eastern Time, or your time zone equivalent. Thanks again. We're truly grateful to be a part of your life and help make a real difference.